Thanks so much, Pearl. And good morning, everyone. My name is Charlene Tonai Din, and I am a program associate here at Keiro. On behalf of the organization, I would like to start off our first presentation by introducing Roxy Kirakosyan. Roxy is the Director of Education and Outreach at Alzheimer's Los Angeles, whose mission is to improve the lives of local families affected by Alzheimer's and other dementias by increasing awareness, delivering effective programs and services, providing compassionate support, and advocating for quality care and a cure. Roxy is a certified health education specialist with a master's degree of public health from California State University, Northridge. She has been an educator in the field of Alzheimer's and dementia for the past 8 years, designing and implementing caregiver and brain health programs. Please join me in welcoming Roxy Kirakosyan.
Hi everyone, good morning. It's a pleasure for me to be here with you today. Thank you so much to Keiro and everyone who has organized this wonderful and valuable caregiver conference. I'm hoping to have a very pleasant discussion with you today, and I have a lot of great resources and information to share with you. First and foremost, I'd like to tell you a little bit about the organization where I'm from. Like Charlene said, I'm from Alzheimer's Los Angeles. I'm the Director of Education and Outreach, and Alzheimer's Los Angeles is a local nonprofit organization that's been around for over 40 years. And we've been providing local programs, services, and supports for individuals who are currently impacted by Alzheimer's disease and related neurocognitive disorders. And what makes us really unique is that we serve diverse communities here in the city of Los Angeles, and we are the only local nonprofit that serves individuals with Alzheimer's disease in Los Angeles. We provide multilingual and culturally competent services, and we're very proud of that because, as you all know, Los Angeles County is very diverse, and we are proud of the many organizations and community partners that we have. We provide early memory loss programs, we provide support groups, workshops, all kinds of supports and services for individuals and families impacted by the disease. And most importantly, we all do this free of charge for families. And we're able to do that because we are a local nonprofit with the generous support of our funders, our donors, and community partners. So I'd like to talk a little bit about the brain because it is a remarkable organ. And we say, if you have a brain, you are at risk of Alzheimer's disease. And it's funny, but it's also, a very straightforward statement. And it's true because we are all concerned for our brain health. And we all want to know, what can we do to prioritize our brain health? So the brain is this remarkable organ that ages and changes just like the rest of our bodies. We say that your brain changes as you age by becoming less susceptible to change and damage. Recall can be challenged as you get older, and this is why we may have tip of the tongue challenges, and our thinking slows down. So there are some changes associated, normal changes, cognitive changes, but very minor, not enough to interfere with our daily lives. And an aging brain is not a disease. So some normal cognitive processes that are minorly impacted are not a part of the disease process. And I'll talk a little bit more about that in the upcoming slides. Everyone has a different experience. And I think this is also a unique statement to make because there's no single chronological timetable for human aging. It does not exist, and we all age differently. And I think it's important for us to make a note of that, especially because sometimes we tend to compare ourselves to each other. So we all age differently. Our experiences in general are very unique, and I think we have many different valuable lessons to learn from that. Some cognitive domains improve with age. Does anyone want to guess which cognitive domains age or improve as we age? Memory? It's a good guess. How about knowledge and wisdom? Knowledge and wisdom are definitely one of those two cognitive domains that improve as we age because of our lived experiences. And that's really fascinating because when we talk about aging, we mostly talk about losses, right? But it's important for us to understand that many benefits of aging, especially the wisdom and the knowledge gained from that. Brain health can be supported early on. And this is actually really significant for us to talk about because brain health is something that we can all prioritize. And brain health is something different for every one of us. But it all starts with thinking about what we can do to prioritize our brain health, how we can minimize our risk factors, and what steps can we take early on to make sure that we are being as healthy as possible. Are we exercising? Do we have a sleep hygiene? Diet and nutrition? Is that in order? There's so many different things to consider. And we have a very specific presentation on healthy brain habits where we teach caregivers and family members and the general public on what you can do to keep your brain healthy and reduce your risk of Alzheimer's disease. When we think of dementia, we primarily think of it impacting our memory. But it's really critical for us to think about all of these other cognitive domains. Here are 8 cognitive domains that are identified on this diagram. When we think of dementia, we primarily think of memory loss. But there's also other cognitive domains that are unfortunately impacted. This is a very slow, gradual process, and I did mention previously that everyone is impacted in different ways, but primarily overall, when we look at dementia and the different domains it impacts, we see that there's challenges with memory, reasoning, language, abstract thinking, attention, perception, organization, and judgment. And reasoning, it's one of those things that gradually diminishes as someone is impacted by a dementia like Alzheimer's disease. And that can make things quite difficult, especially because we rely on reasoning to be able to do majority of the things in our lives. So when one of these higher cognitive processes are impacted, you can imagine that this has a wider impact overall. Normal aging versus possible warning signs. Yes, our brains do age and change just like the rest of our bodies, but there are some normal aging signs and there are some indications that maybe something more serious is going on. Not necessarily warning signs of a dementia like Alzheimer's disease, but some indications that we just want to be mindful of what's going on. So first, let's talk about normal aging. Making a bad decision once in a while. Raise your hand if this is something you've experienced. I think this is something that we all experience because we're human, right? This is completely normal. However, if you are making a lot of new and or out of the ordinary bad decisions, you're falling victim to a lot of financial scams, whereas if that was not something that was a concern for you, that's something that you want to pay attention to. Missing a monthly bill payment. Has anyone experienced that? Absolutely, yes. Especially if you don't have like automatic bill payment set up. It can be very easy to miss a bill payment. However, forgetting to pay the light bill for 6 months and your electricity is cut off, that's a concern, especially because you've been very good at managing your finances, but all of a sudden that is a very difficult task for you. So it's those challenges that are starting to impact your daily life. Those are things that you want to pay attention to. Losing things from time to time. Again, all of us, right? That happens to all of us. And we're human, we make mistakes. But if you're blaming the neighbor for stealing your shirt that can't be found, that's something you want to be mindful. Again, not a warning sign of Alzheimer's, but again, you want to check in with yourself about what you're feeling, what you're going through. There's so many things that can cause memory loss. Just because someone is experiencing challenges with their memory and thinking skills, it does not necessarily mean that it's a dementia like Alzheimer's disease. Of course, that's the first place where our mind goes, but it's important to realize that there are many different kinds of challenges that can impact memory, different kinds of triggers, different stressors in our lives, anxieties, and there's a lot of things that are reversible factors. We'll talk a little bit about that too. Let's talk about the types and stages of dementia. So when we talk about dementia, we talk about it as an overarching or sort of an umbrella term. We use it as a global term. It's used to describe a condition that is impacting the brain. Under that umbrella of dementia, we have the different causes for dementia. We have vascular dementia, where we see blood vessels in the brain that are impacted. We see Lewy body dementia, where there's abnormal proteins or Lewy bodies that are accumulated in the brain. We see frontotemporal dementia, where the frontal and the temporal lobes of the brain are impacted, which results in changes in personality and behavior. There's mixed dementia. There's some reversible kinds of dementias, which accounts for about 10% of the cases. Usually the irreversible types of dementia is the 90% of the cases, which are Alzheimer's disease, frontotemporal, vascular, all of the dementias mentioned here. Alzheimer's disease, sometimes we may use the terms interchangeably, but they are different things. The reason why we sometimes may use the terms interchangeably is because it's estimated that 60 to 80% of the dementia cases are caused by Alzheimer's disease. So Alzheimer's disease is the most common form of dementia. So a little bit about the progression of cognitive impairment. First and foremost, we may notice some mild cognitive impairment. And also it's important to note that this is a very slow, gradual progression. And not everyone who has mild cognitive impairment will eventually have Alzheimer's disease. There are some cases where it can be reversible cause, but for the purposes of this presentation, we are focusing on the irreversible causes. When someone is experiencing mild cognitive impairment, there's some abnormal cognitive decline, but it is not enough to interfere with daily life. Some early indications of Alzheimer's, there's abnormal cognitive decline and interference with some activities of daily life. And in the moderate Alzheimer's, there's the cognitive decline and interference with many activities. And then with the severe Alzheimer's, it's most of the activities. So this diagram relates mainly to function. Alzheimer's disease heavily impacts function. The stages of Alzheimer's disease, we may classify, just for ease of understanding, early stage, mid stage, and late stage. So in the early stages of Alzheimer's disease, an individual may still have an insight into the disease. They may understand and be aware of their diagnosis, but they may have difficulty with multi-step tasks, and they may need some assistance with activities of daily living, but they may have trouble recalling current or historical events. They may become increasingly withdrawn and want to maintain independence. Again, not everybody will experience everything that is listed here, but just to classify the progression of the disease, early stage, mid-stage. Mid-stage, this is where assisted care may be needed because it is becoming more and more difficult to engage and to function. So they may need more increased assistance. Many difficulties with their memory. It's difficult to remember phone number. It's difficult to remember address. Difficulty communicating. And this is that area where many other cognitive domains are impacted. And they may have delusional or irrational behaviors. Not everybody will experience this, but these are very common, especially when we see personality and behavior changes. In the late stages, we see that individuals need help with many different tasks, especially the simple tasks that once used to be easy are no longer easy. Even grooming and personal care like bathing and eating, they need assistance with pretty much all of their activities of daily living. Okay, now we will go into some caregiver tips, and hopefully these tips will be useful. If you are a caregiver, even if you are not a caregiver, it's important to know these tips in case in the future they might be of value to you or someone you care about. When we talk about caregiver tips, we focus on activities of daily living. We have formally identified 6 activities of daily living, and we call it ADLs for short. And basically these are basic everyday activities that allow us to function and remain independent. Things like bathing, feeding, grooming, toileting, dressing, and lower body dressing, upper body dressing. When we're talking about feeding adaptive equipment, here are some things that we recommend that will be useful for you. This may be considered in the middle to late stages. However, this can be helpful and useful at any stage. Utensils that are easy to grab. These utensils look a little different because it's more user-friendly. It's easier for the hand to grab and to use. Non-spill bowls so that it is easier to scoop the food and also easier and avoids messes and spills. Nosy cups. This is where there's a little cutout on the cup. So when an individual goes to drink, they can pull it all the way up and the nose won't interfere to the cup. You want to keep a clean dining area so it's free from distractions. And distractions can be triggers for certain behavioral symptoms. So, and it can make things a lot easier if there's no distraction and everything is in plain sight. And you can use notes on appliances if it is starting to indicate to you that there are some challenges with safety or certain appliances are becoming more difficult to use. Notes can be very powerful and very useful. And jelly drops, these are unique and it's designed for increasing fluid intake, especially if dehydration is a concern, because a lot of individuals with Alzheimer's disease, maybe in the mid to late stages, they might not drink enough water. And if you want to increase their fluid intake, jelly drops are a really unique way to do that. A lot of these things can be easily purchased on Amazon, and we do have links for a lot of these things. And I've shared the slides with Charlene and Kent, so if there's a specific equipment that is really of interest to you, you can reach out to them and they'd be happy to share the link with you. When it comes to grooming adaptive equipment, there are some things that we recommend, and this can also be helpful at all the different stages of the disease. Mouth prop. This is unique. This really helps if they're having trouble keeping their mouth open and you're having difficulty brushing their teeth. So you can use a mouth prop to sort of allow them to keep their mouths open. 3-bristle toothbrush, and this allows for the teeth to be cleaned all different sides at once, so it can be easier to brush the teeth. You can use an oral swab. Usually this comes like alcohol-free mouthwash, especially if there's gum sensitivity. You're not able to use a toothbrush anymore, you can use a swab, and this is a really great alternative. You can also switch to fluoride-free toothpaste, especially if you're concerned with swallowing. And you know, fluoride, when it is swallowed in large contents, can be quite a concern. So in order to prevent that from happening, you can switch to children's toothpaste or specifically a fluoride-free toothpaste. You can also leave instructions on the mirror, because at some point in the progression of the disease, even the most basic and simple tasks can be difficult. So when you break it down, especially if there's many different sequences involved, if you really break it down step by step, it can be easier for the person you're caring for to be able to follow the steps. For example, open the drawer, pick up the toothbrush, open the toothpaste, put the toothpaste on the toothbrush. We do it out of habit without even realizing, but when you break it down, you realize there are so many different steps involved. And then you sort of start to see things from their perspective. Wow, this really is difficult. And then you can also switch to a soft bristled toothbrush, or like a children's or an infant's toothbrush, because they tend to be softer and more sensitive to the gums. When it comes to dressing adaptive equipment, here are some things that we'd like for you to consider. None of these things are mandatory, but a lot of these can be very useful and helpful. And you can use this at any stages. Easy elastic band clothes. So there's no buttons, no zippers, nothing that are being uncomfortable. It's just easy to put on, easy to take off. Velcro adjustable shoes. So there are no shoelaces and it prevents falls as well. Slip-on shoes for comfort and for ease of putting it on and taking it off. And it's also important to label things. You can label things in the closet, label things in the bathroom, in the wardrobe. This is for organization purposes and also helps for the person you're caring for to easily find what they need. When it comes to toileting adaptive equipment, these tend to be more useful in the late to end stages. But again, these are things that you can use at any point. There's male urinals, female urinals, especially if incontinence is a concern. You can use bed pads, you can use bedpans. PureWick, which is kind of like an external catheter. And these are things that are available for you to purchase. Some of these you can purchase on Amazon. Some of these you can purchase at medical supply stores. Some of these things you may be able to get through your insurance. So it depends what your specific situation is, but these are all very useful things that can be very, very helpful for caregivers. When it comes to bathing adaptive equipment, again, mid to late stages, but useful at any point, there are different options for hair washing. Bathing can be a concern, and many caregivers report that they have trouble getting their loved ones to take a bath or wash their hair or change their clothes. So when this is a concern, there are some options here. You can use a hair washing basin like it is pictured here, and you can do this right in their bed so they don't have to get up. Rinse-free soap that technically does not need any water. Dry shampoo so you can feel more clean and less oily. These are some really great options if they are not frequently bathing. And then there's rinse-free shower caps that are a good option as well. And you can make this fun and you can pretend like it's a spa day. That gets individuals really excited as well. And if they have long hair, you can also include water in the shower cap. Some additional considerations. So when it comes to some considerations, we broke it down by early stage, mid stage, and late stage. This is quite a comprehensive list. It doesn't necessarily mean that all of these things need to be finalized and in process at this time, but it's important for us, for caregivers and for family members, to know what resources, programs, supports, and options are available. So when the time comes, they do need these things, they know where to go and how to access. In terms of living options, when individuals are still in the early stages of their diagnosis, they're still quite independent. They're still able to function by themselves, and they can do majority of their activities of daily living, but they may require some assistance, so check-in visits is absolutely recommended and very useful. When it comes to some legal considerations, there are different legal forms that are available that an elder law attorney can help to set up with you. And if you need referrals for elder law attorneys or legal clinics or places where you can go to get legal advice, you can visit our table outside at the vendor fair, Alzheimer's Los Angeles, and we can provide you with some referrals. And our helpline is designed for care counselors to be able to provide those resources to you. There's a power of attorney form, which allows an individual to appoint another person to make decisions regarding finances and healthcare. And there's the POST form, which stands for Physician's Orders for Life-Sustaining Treatment. And this is sort of arrangements that you can make, or the person you're caring for can make, on how they would like to be treated and what their preferences are for their healthcare providers. And there are certain healthcare directives as well that are also legal orders and arrangements that you can make that outlines preferences and wishes for care and treatment. In terms of healthcare services, there's all kinds of options available, but there's healthcare navigators that are available at different healthcare organizations that can provide you with counseling, that can provide you with resources and guide you through the caregiving journey. There's clinical trials that are available both for you and the person that you're caring for, and clinical trials are designed to be research studies. Clinical trials are designed for anyone who's over the age of 18, and you do not need to have cognitive impairment to qualify. They're also looking for healthy individuals as well. And clinical trials are valuable because ultimately they lead to cures and biomarkers and treatments for Alzheimer's disease and other neurocognitive disorders. Participating in a clinical trial is sort of like giving back to science. If you're interested in a clinical trial, the first thing that you can primarily do is speak to a doctor, your doctor, and let them know that this is something that interests you. And because they know you best, they have your whole medical history, they can probably already direct you to very specific clinical trials that you qualify for. And we also have a program on our website. If you visit our website at alzheimersla.org, we have a program called Antidote. And if you put in just some basic information, demographic information in your zip code, we can pull up a list of clinical trials happening near you. We can continue to send you emails of trials that you qualify for. In terms of home safety, again, individuals in the early stages can still continue to safely remain in the home with some check-in visits as appropriate, but they may need some assistance with medication management. So it's important to consider who is going to be that person who's going to manage the medications and how are the medications going to be administered. You want to assess for hazards within the home, and you want to be able to assess to see if there's any safety concerns or risk factors in the home. And watch for wandering. Wandering, even though it may not be a concern right now in the early stages, we do see that estimated about 60% of individuals with Alzheimer's disease will wander at some point in their lives. Engagement. You want to encourage independence as much as possible because it promotes their sense of purpose and dignity, and that's what really gives them, that sense of contentment. So you want to make sure that you're also matching the abilities to the skills. You want to match the activities to the skills as well. And there's different kinds of activities that are appropriate for individuals with Alzheimer's disease at different stages. And we do have activity programs at Alzheimer's Los Angeles. And there are certain companies that provide activity kits or activity boxes. We can also provide you with more information if you have a chance to visit our table. We'd love to give you that information. In terms of transportation, driving can be a concern. Just because there is a diagnosis of Alzheimer's disease does not mean that they have to stop driving right away. A lot of individuals in the very early stages can still continue to drive safely. However, it is important that they get evaluated to make sure that it is safe for them to do so. And some family members report that they have concern for their particular family member, that they are no longer able to continue driving safely. So in that situation, what you can do is there's a specific form that's available on the DMV website that you can download, fill it out, and you can remain anonymous. It's confidential. So if you report, let's say, your friend or your family member, they will get a letter in the mail that sort of states that this is a reevaluation or re-examination of your driving capacity or your driving ability. It'll be a generic letter that the DMV will sort of evaluate to see if it's safe for them to continue driving. That form, again, is on the DMV website. It's available for you to download, and we can guide you to that as well if you visit our table. There's lots of social services that are available for families and caregivers to support them during the caregiving process. There's early stage services. We have a lot of early stage services at our organization. For example, we have support groups for individuals who are in the early stage. We have a program called the Memory Club, which is an 8-week supportive engagement series designed specifically for individuals who have a diagnosis of Alzheimer's disease and their care partners to attend together. Some middle stage considerations, living options. This is not completely mandatory. It may not be necessary for a lot of families, but it's important to know what the options are and what's available out there. So there's assisted living facilities, there's boarding care, memory care. I'll define all those terms in the next upcoming slides. In terms of legal arrangements, you want to be able to determine capacity to see if the individual that you're caring for is still able to make decisions in terms of healthcare and finances. In terms of healthcare services, there's lots of programs that are available. There's the GUIDE program, which is a nationwide model through the Medicare program, and it provides a framework in order to support caregivers and individuals with the diagnosis. We'd be happy to provide more information about that at our table. There's CalAIM, which is a program through Medi-Cal. There's home health services, palliative services, all kinds of services and supports available for caregivers and family members. In terms of home safety, there's wandering prevention. There's all kinds of devices and gadgets that can help families to prevent wandering. There's the LA Found program, which is a program through the LA County Sheriff's Department that is sort of a tracking program for individuals who have dementia and Alzheimer's disease. And you can get enrolled in that in order to prevent certain emergency or crisis situations like wandering. There's also the Medic Alert Safe Return program, which is an identification bracelet or a necklace. Many of you may have seen it, that an individual with dementia or Alzheimer's disease will wear. And if they do happen to be wandering and they get lost, first emergency responders are able to locate them. There's a unique identification on their bracelet or necklace, and they can easily pull up an image and be able to identify that individual and return them safely to their home or living arrangement. And we recommend both the person with dementia and Alzheimer's to wear it and also their caregiver as well. And sometimes caregivers say, why do I have to wear one? Well, the reason why we encourage caregivers to wear one as well is in case an emergency, if something were to happen to you, first emergency responders would know that you are caring for someone with dementia or Alzheimer's, and they would be able to check up on them to make sure they're okay. In terms of engagement, there's adult day programs, there's senior centers. Senior centers are not dementia specific, but adult day programs may be. And this is lots of meaningful activities that can help individuals and give them lots of meaningful activities and independent things to do during the day. Transportation, there's medical transportation provided by different healthcare organizations. And we have a form on our website. We can help you with that as well. Social services, there's all kinds of social services that are available to families. Adult day programs, in-home supportive services, or IHSS for short, that helps to provide some relief for caregivers, and they bring in professional paid caregivers. There's meal delivery services like Meals on Wheels. If you're interested in any of these services, we can give you more information. And of course, there's us at Alzheimer's Los Angeles, where we provide caregiver support, and we also have a care management team. And we have care counselors that can walk you through your caregiving journey, and we can provide you with tips. We can provide you access to many of these resources that I'm talking about today. Some late stage considerations. Here are some living options. Again, not completely necessary or mandatory, but it does become more and more difficult to care for somebody who is in the later stages of their disease process. So I think it's critical for us to know what the living arrangements are, what the options are. So in case if we are unable to safely care for them at home, we know that there are things like skilled nursing, boarding care facilities, memory care facilities available for us. In terms of legal considerations, some families may explore conservatorship, and conservatorship is sort of a legal arrangement where the court appoints someone to be able to make decisions in terms of healthcare and personal matters when that individual no longer has the capacity to do so, so they are considered incapacitated. Healthcare services, there's all kinds of programs that are available to be able to help families and caregivers, like hospice care, there's CalAIM, there's palliative care. All of these are information that we can provide for you when you visit our table. Home safety, emergency preparedness, there's all kinds of adaptive equipment. Some of the equipment I talked about today, but there's additional larger equipments that can be installed, such as bed rails, hospital beds, foldable rails, handlebars, grab bars, all kinds of things that can be installed. And under the Americans with Disabilities Act, individuals who have a diagnosis of Alzheimer's disease have certain rights to have these things installed in their home. And we can provide you with more information as well. Engagement, in the late stages, we want to focus more on sensory activities. So things that are related to like tactile, like touch, sense of smell, hearing, things like music, and things where they can use their hands. And those really provide for meaningful activities where you can keep your loved ones calm and content and involved. In terms of transportation, there's medical transportations that are available for families to take advantage of. There are many different healthcare organizations. We can provide you with more information on that, but also social services. And social services, there are many different organizations, like the organization I'm from, and we'd be happy to provide you with a list of support groups. We offer over 40 different types of support groups in many different languages for many different kinds of caregivers. And the support groups are a wonderful way for family caregivers to receive support, education, referrals, and to be involved. And you have that sense of community, knowing that you're not the only one experiencing this. There's many others who are currently going through what you're going through. So that sense of community and support is critical for caregivers. Final arrangements, that's also something our organization can sort of guide you through. We can refer you to professionals and organizations that can help you handle final end-of-life considerations. So if this is something that is of interest to you, please get in touch with us. We'd be happy to provide you with support on that. And now we go into different levels of care that are provided. So when we talk about levels of care, there's independent living, and this is where individuals are very self-sufficient, very independent. They can do the majority of the activities of living by themselves, but they may need some minor assistance or minor help or check-in visits from time to time. There's assisted living, where individuals may need more assistance. They need more assistance with their activities of daily living, or those 8 ones that we identified earlier. Meals, medication management, personal care, grooming, all of that. And many of the assisted living facilities may have nurses and staff working with the caregivers. And so they're really there to support the person with the diagnosis. There's different boarding cares available. They may also be known as residential care homes or private homes. And it's a small group of individuals, usually about 4 to 10 residents within these homes. They may or may not be dementia specific. When we have a list of these different levels of care available for you, so we can refer you to different boarding cares, assisted living facilities, if that is something that you are considering, or we can also refer you to individuals, placement agencies who have already done their research, and they can guide you through this process. And there's memory care that may be dementia specific, and this is a more different level of care where there's a secure environment, and everything is provided to the individual with dementia to make sure that they are as healthy and as well taken care of as possible. There's 24-hour care being provided at memory care facilities. And there's also skilled nursing facilities. These are for older adults who need 24-hour medical care. They may stay in the skilled nursing facility after a hospitalization or after a rehab. And all kinds of medical supervision and therapy is provided at a skilled nursing facility. There's respite care, and respite care is available to all caregivers, and it provides short-term relief from caregiving duties. And this can be done in the home or at an assisted living facility or skilled nursing facility. So this can be done at any sort of living arrangement. It's really designed for the caregiver to take a little bit of break from their caregiving duties. There's palliative care. This is available for individuals who have a serious illness and they need more of a plan management and more supportive care along with other treatments. Focuses on supporting family care needs for chronic conditions. There's also emotional support as well. It can be done in the home or in other living arrangements like assisted living or boarding care. And then there's hospice care, which is in the final or end stages of the diagnosis, usually in the last 6 months of life. And this is designed to support both the individual with the diagnosis, their family, and their care partners. And we do have some referrals if hospice care is a resource that you're looking for, if you'd like more information on this. So if you visit our table outside in the vendor fair, we'd love to connect you to these resources. There's also home care and home health care. There's a distinct difference between the two. There's home care where it's not medical assistance, And this is provided to those who need help with their activities of daily living, but they do not require any, medical treatment. They may include services with bathing, dressing, medication management, meal preparation, services for companionship, often provided by caregivers and aides, and it's usually private pay. Generally, insurances do not cover home care. And then there's home health care, where there is a medical need. So that's the primary difference between home care and home health care. With home care, there's no medical assistance that's provided. In home health care are the medical services that are provided by the licensed trained medical professionals. That can be nurses, physical therapists, occupational therapists, social workers, or a team of all of those mentioned. This can include medication management. They can monitor vital signs, blood pressure, heart rate, make sure everything's okay. They can do injections if that's something that's appropriate and necessary, and all kinds of therapies. This is recommended for those recovering from surgery, managing chronic conditions, or those who are receiving palliative care. A little bit about Medicare and Medi-Cal, because those are also terms that we used in this presentation. There is a difference between the two. I won't go into too much detail because I'll let my colleagues with the expertise do that for me. So if you visit our table, we have care counselors there, and we have individuals there who have more of a broader understanding and who can give you more information on this. But Medicare is a federal health insurance program. This is available to people over the age of 65 and some younger people with disabilities, and it generally covers medically necessary supplies and treatments. So here are some benefits of Medicare. Benefits for older adults with dementia include hospital coverage, medical coverage, Medicare Advantage, and prescription drugs. So there's Part A, Part B, Part C, and Part D. And also home health care can also be included on this. It covers some aspects of home health services. It does have some limitations that it does not cover long-term care, long-term non-medical care. Usually long-term care insurance is something that will cover a lot of those expenses, but that comes pre-diagnosis. So long-term care insurance is something that families have to, it's recommended for families to enroll in long-term care insurance before there is a diagnosis. There's also Medi-Cal, which is a state-specific program that offers healthcare coverage for those with limited income and limited resources. So Medi-Cal is California's Medicaid program, and this is funded through both federal taxes and state taxes. Here are the benefits for older adults with dementia when it comes to Medi-Cal. Long-term care covers some long-term care if they are medically eligible. Home and community-based services, and it helps to keep them safe in their home for as long as possible. Behavioral health services, it provides mental health services for behavioral or psychological symptoms. Medicare savings program, and medical management care plan. Again, my colleagues at vendor table can provide you with more information on this. But I think it's important for us to know the differences between these two, and these are important considerations for us to have. So speaking with the doctor, this is also critical. A lot of caregivers, when they do make the appointment with the healthcare provider, they don't feel that they are prepared, they don't feel like they have all the resources. So it's important for us to be prepared to know what to expect and how to make the most out of the limited time that we have with the doctors. So if you did make a doctor's appointment, what are the next steps? What comes after that? This is not, a comprehensive list, but these are just some recommendations that we have, and preparation is key. And making that appointment is probably the most fundamental step. That's the most important step. So first and foremost, it's important to write down your concerns and write down the what, when, where, how often. If this concerns you or someone that you're caring for, a family member, a friend, a spouse, because usually you have very limited time with a healthcare professional and they want to know what's going on, how long has this been going on. So it helps to have like a log or a journal entry so they can be able to identify patterns and to really understand what that individual is experiencing. It's also very helpful for the doctor to know the person's baseline, Baseline is how they behave or how they are typically, so they can know if there's any significant changes that need to be tracked over time. List of all medications. It's important to have this at the doctor's appointment, but it's also important to have this even before times of crisis or even before anything happens, because this is the most important things that doctors, first emergency responders need to know: what medications they are taking, the dosage, and how often. This includes vitamins, supplements, and prescriptions. So all of that is critical for the doctors to know, especially because the FDA doesn't regulate the vitamins and supplements, so it's important for them to know what that individual is taking. Write down your top 3 questions. You can easily forget when you go to the doctor's office, especially because you have such a limited time. So it's important to be prepared and know what questions you're going to ask. What will the doctor do? Again, not a comprehensive list, but the doctor may conduct some of the following that we have listed here. They may ask about a history of the complaint and possible family history, because they want to know how long has this been happening, is there a history, how long has this been going on, the who, what, when, where, how, all of those. They may do some laboratory exams, some blood work, some routine exams, just to rule out other causes. Because like I mentioned earlier, just because there is memory loss present, it doesn't necessarily mean that it's a form of dementia like Alzheimer's disease. There's many different things that can cause changes in memory capacity, like urinary tract infections, certain cancers, even acute conditions. Acute conditions are the #1 cause for certain dementia-like symptoms. They may also do a possible brain scan, and this can help them to identify what's really going on in the brain, like an MRI or a PET scan. Because Alzheimer's disease is primarily characterized by amyloid protein that is a buildup in the brain that presents itself in the form of amyloid plaques and tangles. So when there is brain imaging or brain scans, healthcare professionals are able to identify if that's what's really happening within the brain. They can also ask about performance on everyday tasks, how well somebody performs on their activities of daily living, because they want to be able to assess function. They may also conduct a memory screening, and a memory screening takes about 20 to 30 minutes, and traditionally it's done paper and pencil, but there's now more sophisticated levels of cognitive screening. But we do recommend everyone to take a cognitive screening, even if you don't have any concerns with your memory right now, because you can have a baseline for yourself. You can know how you are today, so in case in the future, if there is a concern with memory capacity or thinking ability, you can go back, retake that exam, and your doctor will have something to compare it to. And some of you may have an experience with a memory screening, some of you may not, but it is something that you can request from your primary care physician. If your primary care physician is not able to do a cognitive screening, they can refer you to a specialist, like a neurologist who can conduct one for you. But again, it's very easy. It takes about 20 to 30 minutes, and everyone should have a cognitive screening in their chart. They may even discuss clinical trials in your area. Again, this is an option that's available for you. It's important for us to know that this is available to everybody. You don't have to have a diagnosis to participate in a clinical trial. They're also looking for healthy individuals. Some trials even provide incentives for individuals, and there's some that are even virtual if traveling or distance is an issue for you. So there's all kinds of clinical trials, research studies available that you can participate in, and this is a really great way to sort of give back to science. We ended about 3 minutes early, which is good. I'm happy to take any questions that you may have, and Shirley will facilitate that.
Thank you so much, Roxy. Can we get another round of applause? Wonderful presentation. And thank you so much. I think my main takeaway is that the caregiving journey can be overwhelming, but there's so many resources and organizations such as Alzheimer's Los Angeles here to help you navigate your journey. And so with that, we'll transition into the Q&A portion. If you have any questions, please raise your hand, and we have runners with mics who will help you ask your question. Does anyone have questions? Yes, we have in the middle.
About what age does Alzheimer's start?
That's a great question. So generally, we say that Alzheimer's disease impacts individuals over the age of 65. That's when they typically start to see the signs and symptoms of the disease. However, there's research that shows that Alzheimer's disease starts in the brain 20 to 30 years prior to the diagnosis. So, and brain health is something that, we all need to prioritize. But primarily, it's characterized for individuals over the age of 65. But that's the typical sort of the late onset Alzheimer's that we talk about. There's also early onset Alzheimer's that impacts individuals below the age of 65. But the majority of the Americans today, it's estimated that 7 million Americans are currently living with Alzheimer's disease. The majority of those Americans have the typical late onset over the age of 65. Below the age of 65, generally there's a genetic component to Alzheimer's disease, but that accounts for less than 3 to 4% of the cases.
Thank you for the response. Any more questions? Yes, we have in the purple jacket.
What is your opinion about supplements like Nariva or Prevagen? Do they help?
It's not my opinion, but there's a lot of research that currently shows there is no single pill or supplement that you can take to improve memory. And that's our stance at Alzheimer's LA, and that's the stance at many of the organizations like CDC, World Health Organization. It's recommended that lifestyle plays a huge factor in that. So physical exercise, the recommendation is 30 minutes of physical activity every single day. Diet and nutrition, sleep hygiene, 7 to 9 hours of sleep every single day. Research is quite clear that if you follow those lifestyle factors closely, strictly, and adhere to it in the long run, you'll see many, many benefits. Those things work much better than any cognitive supplement or medication that you can take.
Thank you. I saw a question.
You seem to be doing well cognitively. What are the chances of getting dementia as you continue aging if you're over 90?
Well, I think you deserve a round of applause. If you're 90 years old and you're doing well, that's amazing. And I think at this point, that's a great question, but I think at this point, what's more important to consider is how you can maintain your quality of life and preserve the sense of community and friendships that you have around you. Because it's a really critical age for you to do things that are life-affirming for you to have meaningful activities, to continue to be active, to continue to be involved. So I don't know if I can answer that question, but it's a wonderful accomplishment, and just continue to be active, do things that are socially stimulating, cognitively stimulating, and I think you're on the right track.
That's a very good answer.
Yes, in the blue. We have a runner coming to you.
What would you say to a situation where my parents are both alive, they're both 87, and they are kind of in denial, they can't take care of themselves, they don't want help, and the signs are just so clear. So I listen to a lot of these things and I feel like it assumes a baseline and they're not even there, like they're not willing to declutter their home. So I can't even imagine having a clean table where they can, I've done signs, I've put little post-it signs, I've made all kinds of things to help them remember their medication. And my dad doesn't like being treated like a kid, so I'll just tear off the poster and, the time that I spent to make these things to help them remember. So, what would you say to people if they go to the doctor, they don't like what the doctor says, oh, we'll get a second opinion, and they don't follow through. And so just so many things seem so impossible.
Absolutely, yes, that is very difficult, and I commend you for taking care of your parents. That's such a big task. I think first and foremost, what's really crucial is for you to join a support group. because what you're telling me is something that is so common that a lot of family members, a lot of adult children experience, because it's a role reversal, right? Your parents take care of you, but now the roles have switched. You're taking care of them. And it can be a quite challenging task from your experience. So first and foremost, join a support group specific to adult children, because they're experiencing what you're currently going through, so they can provide you with advice. But I think ultimately, it is a very challenging task, and we do have some caregiver tips. We have caregiver tip sheets on our website that discusses a lot of the questions you have, but also caregiver classes. So we have a specific class on personality behavior changes. We have a very specific class on communication, because communication can be very challenging. So we go through the golden rules of communication. Do not argue, do not reason, don't confront, agree, and accept the blame. It's easier said than done. It's easier said than done, but sometimes that makes a world of a difference. So in a situation where your father will say, "What dementia? There's nothing wrong with me. I don't need to go to the doctor." What you might want to say is, "Well, you have memory loss. You couldn't forget to put on your shoes." This because you're trying to reason. So what we recommend counselors is agree. Yes, there is nothing wrong with you. You're right. You're absolutely right. You can't do everything by yourself. However, it would make me feel really happy and relieved that you went to the doctor. And you sort of bring the attention back on you. There are some tips and tricks. Again, some work, some do not. It's a matter of trial and error. But if you join a support group, join our educational classes, and be involved with us, we can help you along the way. But thank you for all your hard work. That's amazing.
Thank you so much. Any more questions? I will note that we have on our evaluation form whether you're interested in a support group. That's something we're trying to gauge within the community at Keiro. So please fill out that evaluation form as best as you can. And there's also resources at Alzheimer's Los Angeles for caregiver support groups. Yes. The question was, what about Orange County and providing caregiver resources?
Absolutely, yes. They are our sister organizations. So there's Alzheimer's Orange County, there's Alzheimer's San Diego. We work very closely with them and we collaborate with them. A lot of the services programs they provide are similar to ours as well. So if you have any families within those boundaries, you can reach out to them.
Any more questions? Don't be shy. I guess I have one. If there's one thing you would like our audience here to take away from your presentation, what would it be?
Oh my goodness. Well, I just shared so much information. I'm sure that was a little bit of overwhelming. One key takeaway. I'm a very big component, I should say proponent of brain health, and being a health educator myself, I think I have a sort of an obligation to provide this sort of information. I think the biggest takeaway here is lifestyle truly matters, and the choices that you make every single day, from the things that you eat to the way you exercise to the way you socially engage, all of that is critically important to brain health. And it's, like I said earlier, I answered one of the questions, that's better than any pill or any supplement that you can take. So start with very small gradual steps. Sometimes caregivers say, I'm so overwhelmed, I don't know if I should start with the diet or the exercise or the cognitive stimulation or the sleep, what should I do? And we always recommend start with very small steps that will lead to bigger progress ultimately. So if it's sleep, that's something you need to work on, then make a very achievable, attainable goal for yourself and follow through. And once you feel like you've completed that, then move on to another lifestyle factor. But lifestyle is critical, both for you and the people that you're caring for, your entire family. So if you can make any adjustments, I recommend you start there.
Thank you so much.
Thank you. Thank you very much.
Yes, can we get another round of applause?